Hi, everybody, it's Steve. Hey, thanks for joining me today. Hey, in this video, I'm going to do a follow-up to my rotator cuff and bicep surgery series, and I'd like to go ahead and give the update on my experience from physical therapy on to today. It's been about 3.5 years since I had my procedure, and I'm pretty well, 110% now from where I was then, but I just want to give a little bit of an update of where I left off in the last video, which I think was when I was just getting ready to start PT, or I was a week or two into PT, but kind of speak through that. So what has ended up, my PT ended up being 6 weeks total. I believe it was twice a week. I think I was doing Tuesday, Thursdays. I think they might have been an hour appointment, somewhere around there, 45 minutes or an hour, whatever they were. You would go in, you'd ride on the bike a little bit to get your blood flowing, and then you would do whatever exercises or stretches. Sometimes they do bench work where you lay down and they would do some stretches or some tissue massages for the scar tissue and help with range of motion, and that helped. They give you homework to do. You do some exercises there. You would do them a little bit, and then they would do whatever the rest of that protocol was, maybe some stretching, some icing, that type of stuff. And then you would have your homework. You would basically, whatever you did there was oftentimes the homework that I would have to go home and do once a day, twice a day, whatever the frequency was on the different things, so that I was ready for the next session so I could progress through. And that all went pretty well. One thing looking back that I would have done different was I would have been my own advocate. I didn't really care for my PT person, and I didn't realize that until 3 or 4 weeks in. I had somebody else substituted for him, and I realized how much better the service was from this other person, that I wish I would have. I wasn't super happy with him to begin with, but I figured that's just the way it was. But knowing that then, I wish I would have spoken up and talked to somebody in the office to say, hey, can I get a different therapist, because I'm just not clicking with this guy, and I don't think I'm getting the attention that I need as a patient. So that's one thing. Be your own advocate is one of my suggestions there. Also, doing my homework. I made it a point to do the homework that they assigned that was expected, and it's also part of my recovery. I've got to be committed into that. But also at the same time, don't overdo the homework. Talking to somebody I worked with at the time, and she was speaking about her husband had similar type of surgery, and he overdid it. He went full bore, like business as usual, and then he re-injured it and had to have a whole second surgery and then restart the whole process. And the second one wasn't even as good as the first one by that point, because there were a lot more complications in the whole mix. So that's something I was pretty aware of. But at the same time, I didn't want to overdo it, and I didn't want to underdo it in the sense of being too precautious. So it was hard to find that balance of what's good pain and pushing it versus overdoing it and risking getting injured. So, but that was something I just had to work through as time went on. What can I do? What can I do? Push it a little bit, but when you know that you feel it's a little bit on the edge, then kind of back off. So that was my approach on how I did things, particularly when it came into the weather in the fall after PT was completed. I had the PT starts off with just getting range of motion to get some of the stiffness out so you can actually move a little bit. And then you eventually went through the strengthening exercises and range of motion exercises. The last things that came back were, I believe it was the overhead, being able to lift my hand like over my shoulder because of the work that was done up in here. Eventually, and then the last thing to come back was the hand behind the back, because it was like I couldn't even get it anywhere past my side or to my side for a long time. And then eventually it gets to the point where you can put it in your back, behind your back. So that took a long time. And then anything overhead, there was no strength. I had zero strength in that arm with any load bearing or anything. When we got to the point where I could, the strength wasn't there. So I was real cautious into the fall when I would rake leaves and stuff like that. I was totally favoring my left side because my shoulder with surgery was the right-hand side, to the point where I overcompensated with my left-hand side, and I eventually had to keep telling myself it's okay, use that right-hand side. It needs to be re-strengthened. So let's see, a couple other things during the PT sessions and even just post that is it takes time to recover. I know I've left this in a lot of the replies to a lot of the other comments, is that was one of my biggest things. My mind was ready to go. I'm like, hey, it's been long enough. You should be healed. it was just an injury. You're good to go. And the body's saying, nope, I'm not done yet. There's a whole process of healing that needs to go on here. And that was one of my biggest things in my own mind. And then you start to play the games in your head, at least I did, was, oh, is it ever going to recover 100%? Am I ever, is this the way it's going to be, and all that stuff. But I had to think past that, and I looked past that, and I was accurate in that. I'm 110% now compared to where I was. And who knows how long I suffered and favored things because of the injury before I got the work done. So let's see, pain before, during, and after. During PT, I noticed that sometimes the PT sessions, you'd feel really good afterwards because you do the exercises and you get range of motion and all that. You get all that. And then they would ice it, and the ice pack felt like $1 million. I mean, it felt so good when you're done. But the next day, man, I was sore, super sore. So it got to the point where I would take my leave before I would go to my appointment so that it was in my system. And that helped some. A few days I still had the pain. The sessions that really pushed it, I got some of that pain that was there like in that first couple weeks when things were healing and you could tell that the nerves were trying to reconnect. Had some of that pain would come and go. But a leave, I think I was taking a leave at the time, and that worked fine for helping with that. And then the big thing was that he suggested, I think my PT guy said, take an anti-inflammatory to kind of help with that. That's his advice to me at the time. So I don't know, everybody may be different there, but let's see. I already mentioned about not being discouraged. The body follows the mind. The mind thinks you're ready to go, but you're really not. I just put a couple notes together here. I just wanted to make sure I covered. Let's see. Something else too, kind of looking back after the fact, so I went through my 4 weeks post-surgery until I started PT. I had 6 weeks from PT. They took the range of motion stuff with the little calipers and all that stuff at the beginning and at the end, and then they got those notes to the doctor. The doctor released me to go. And then I was good to go, and I was on the road to recovery from there. Some of the medicines that the doctor had given me at the time, I talked to my cardiologist about later, like a year or so later, and she told me that I shouldn't be taking that because of whatever. That's not ideal for my my situation, which is actually, looking back now, I wish I would have had that conversation with my other doctors to say, hey, this is what the shoulder surgery prescriptions are going to be. Different doctors, different offices, just to make sure that everybody was kind of on the same page there. So it didn't cause any problems for me, but it was something that, boy, if I would have known that would have been nice to have had that conversation back then. So that's one thing would be to cross-check the medications across the different doctors, both ways, really, so that doctor knew when he was writing that prescription. Because I think you tell them, but just want to make sure everybody's all on the same page. So, but that's it. I don't want to go too long on this, but I've answered a number of questions, and I wanted to go ahead and put some of these things in a video to help anybody that might be going into this, some things to have some food for thought. Again, I'm not giving advice or whatever. This is just my personal experience, and for what it's worth, I just want to share to the collective community. So I want to thank you. If you have any questions, please ask them below. Please consider sharing your experience with the community if you're so inclined to record a video and put it out there. I know there's some people that had videos. That's what helped me as I kind of readied and traveled that road, both to pre-surgery as well as through the recovery process of it. So, but that's all I got. I want to thank you very much and have a great day. Bye.